It used to be that at any time, anywhere from 60 to 80 young people were being housed at Long Creek. Now it's about half that.
That's because the state continues to move away from using the facility to incarcerate kids. But healthcare providers say alternatives to treat troubled youth have not caught up with the times. News Center Maine's Jack Mulmid is here with more on that. Jack.
Well, that's right, Chris and Amanda. Well, the Bangor Daily News was the first to report on the story, and they showed us that troubled kids in Maine are really stuck between a rock and a hard place. We have Long Creek Youth Development Center, which is riddled with staffing shortages and reports of poor conditions, slowly being used less and less. The alternatives, though, are not much better.
In the juvenile justice system, which is confidential and where there isn't many public windows.
Callie Ferguson is a reporter with the Bangor Daily News and spent months reporting on a dire situation in the state. How do we get children in crisis the mental health care they need?
Sort of a cycle of headlines about the juvenile justice system in the last 5 or so years.
Headlines like staffing shortages at the youth prison, contributing to kids not getting the services they need. Reports of violence and dangerous use of force by staff behind closed doors.
Much of the reporting in recent years has been specifically about Long Creek, the state's youth prison, but increasingly most youth who are involved in the juvenile justice system aren't going to Long Creek.
And that's where this sweeping report comes in from the BDN.
Wanted to do reporting that looked at the entire system and to better understand what was happening in the community.
The report found 3 key findings. 1, there is a severe lack of mental health resources for children who need it most. 2, the state is continuing to divest from Long Creek, which is being used less and less with each passing year. And 3, while the facility is used less, there's still a glaring gap in mental health resources, and it has not been fixed.
That's sort of the jumping off point for this reporting, is sort of looking at what it looks like in our communities when those things don't exist.
What we're left with is children waiting weeks to get the help they need, with the number of kids in crisis going up.
Give you a sense of it, we've gone from seeing a couple of hundred kid and child and adolescent visits in the emergency room every year to over 700 last year.
Maine Medical Center Director of Emergency Psychiatry, Dr. Chris Racine, says they usually know exactly the resources a kid needs when they show up to the emergency department, but
wait lists for outpatient resources can be weeks, months, and sometimes years for certain services.
This is often where kids have to wait. These photos provided to us by Maine Medical Center, rooms designed to hold a child in a mental health crisis for a couple hours. Some kids stay here for weeks.
In certain cases, if somebody ends up in an emergency room for a prolonged period of time, their condition can actually deteriorate.
Facilities where a child can get mental health resources just don't exist at the scale needed to fit the demand. According to a report from the Department of Corrections, there were 2 facilities designed to house incarcerated youth in a more mental health-based setting. Both of them failed due to staffing.
The state does not appear to have a comprehensive plan for fixing the problems that have long plagued the juvenile justice system.
And we asked the Department of Corrections for an interview about the future of juvenile justice. We were told the Commissioner, Randall Liberty, was not available. But documents obtained by News Center Maine from the Department of Corrections show it has been reluctant to offer alternatives to Long Creek in the legislature. Last legislature, a bill was brought forward that would ban certain uses of force against kids at Long Creek. The DOC opposed this, saying it was too risky for the employees there, and after calls to close it down were heard in Augusta, the Juvenile Services Commissioner said, quote, last week's public hearing was very ugly.
That doesn't mean that I don't think that there are conversations happening.
The BDN reports there are commissions looking into Long Creek's future, but until we know more,
the sort of cavalry isn't coming, and what's the plan going to be for fixing this? Because the stakes are not only high for parents and communities, but for the kids themselves, who often are in as much jeopardy as they may be, putting others in.
And the Department of Corrections, which opposed previous bills looking to either divest or close Long Creek altogether, is now looking towards the future. At the end of its 2023 report right here, we see that the Juvenile Justice Advisory Group, which has members from the Department of Corrections and Maine DHHS, is working to present a 3-year plan this year meant to provide an outline of how to best serve youth in crisis in Maine.
Glad they have a plan to go forward. Thanks, Jack.
Thank you.